Naturopathy has been a beacon of hope for those in need, serving communities with unwavering dedication. From its inception, the Society has worked tirelessly to promote healthcare, education, and overall well-being, with a strong focus on supporting marginalized sections of society. Its innovative programs, impactful initiatives, and commitment to excellence have made it a trusted name in the field of healthcare. The Venu Naturopathy Center is a vital extension of this vision, combining the wisdom of traditional healing with modern research. Rooted in the principles of nature-based healing, the center offers holistic care tailored to address the unique challenges of today's world. By promoting balanced living, preventative care, and sustainable well-being, the Venu Naturopathy Center is creating pathways to a healthier and more harmonious future. As we gather here today, it is essential to acknowledge the growing importance of healthy aging. In a world where chronic diseases like diabetes increasingly impact lives, the need for integrated approaches is more crucial than ever. Naturopathy, with its focus on balance and natural healing, offers innovative strategies to manage and even prevent these conditions. By blending modern medical advancements with time-tested naturopathic practices, we can pave the way for healthier, more fulfilling lives, especially as we age. We will now begin hearing from our distinguished speakers. First, we would like to welcome Professor Naval K. Vikram, Professor, Department of Medicine, Associate Dean Examinations, All India Institute of Medical Sciences. Dr. Naval K. Vikram has been involved in research in the mentioned fields for over 2 decades and has contributed to more than 200 scientific publications which are well cited. Some of his noted research contributions include studies on body composition, correlates of insulin resistance, metabolic syndrome, type 2 diabetes, AMSLD, commonly known as fat liver, and sarcopenia in Indian adolescents and adults. He has guided more than 25 MD students till date and has funded several funded research studies going on. Several of his studies were the basis of the consensus guidelines for the diagnosis and management of obesity for Asian Indians published in 2009. These guidelines have been revised recently, and he played an important role in the process of formulation of both the guidelines. In recognition of his research work, he has been conferred various national and international awards. Please join me in welcoming Professor Vikram.
Thank you, sir.
You can review we will make available the recording of this session on YouTube, so you can have the whole session. Yes.
Very good evening to everyone, and thank you, Dr. Maria, for kind words and inviting me to speak about this topic, which is very close to my heart. So I'll be briefly just talking about the care for diabetes in elderly or the aging population, because it's essentially the same, but there are some considerations which have to be taken into account to avoid complications and have better control over the things. Yeah. So this is just to just shown here how the diabetes is increasing over a period of years, decades, and this was the idea of Atlas in 2021. It shows there's a significant increase in diabetes, particularly in our region, that is the Southeast Asia. Next. And here we see they are the top 10 countries with diabetes. This is just to show that you see that India is the next only to US and China. Now, there are several risk factors in elderly individuals because with age the glucose metabolism changes. With age there are more and more problems, so multiple drugs are being given which may have interaction with each other. And there's also decrease in the physical activity with increasing age. There are many coexisting illnesses and also increase in the body fat and decrease in the muscle mass. That is, there's obesity along with sarcopenia, decrease in the muscle mass. That's a very important thing. So all this can lead to development of diabetes or increase or exacerbate the existing illness.
Yes, ma'am.
Now these here it shows the complication and the comorbidities. Like I said earlier, there is increase in cognitive impairment, and elderly individuals are more prone to develop hypoglycemia, which is a complication of tight glucose control. And there is bone fragility, loss of muscle, and there are the several complications which are seen more in the elderly because they have been living with diabetes for a longer time. These complications appear about 20 years or 25 years after onset of diabetes. And the life expectancy, as this slide here shows, that the life expectancy, which is as we go beyond 65, the life expectancy at the risk of mortality, life expectancy decreases, the risk of mortality increases. So clinical conditions, as I mentioned earlier, there are mental health issues, there's cognitive decline, cardiovascular issues are there, increased proneness to falls, fragility, there is impaired bone health, and also the urinary problems and several disabilities. So all this has to be taken into account while managing diabetes, which is it's a very complex disease. Yeah. The factors which need consideration, particularly in the elderly, are the geriatric syndromes, which are associated with cognitive impairment and malnutrition, polypharmacy, other comorbidities like kidney dysfunction, the cardiac dysfunction, liver dysfunction. So major organ dysfunction has an implication on how you treat, because some drugs have to be avoided, some drugs and the dose has to be very carefully monitored, and there is the high glucose variability also. With increasing diabetes, there is always risk of hypoglycemia or hypoglycemia unawareness, which is a problem which is seen more commonly in the elderly individuals with diabetes. And in many societies, including our Indian society, this may not be so true. The low social support, because we have a good family structure, living in joint families. So the support for elderly with these problems is still good, but in nuclear families there may be a problem that elderly are not living with their children, and there the social support system, the network would be poor. So there may be low social network support, there's food insecurity, and low health literacy, and also economical issues. So all this has a significant impact on how we manage diabetes. So the goals of managing diabetes are not the same as that in younger individuals. The difference being that if the person has intact cognitive functions and is otherwise does not have any other organ dysfunction, then the goal may be similar to what is there in the younger individuals. That is, hemoglobin A1C up to 7.5 may be acceptable. However, if there are multiple problems, multiple comorbidities are there, and there's some cognitive impairment, then one would like to be a little relaxed in the cutoff of blood glucose or hemoglobin A1C in those individuals. And if there are much more problems, then HbA1c generally should not be relied upon. One should rely upon the blood glucose levels only, and the range should be in the fasting state 100 to 180. This is to avoid hypoglycemia, which even a single episode of hypoglycemia can kill a patient. Even if the blood glucose is high on few occasions, that is not going to have any immediate impact on the individual. But a single episode of hypoglycemia in an elderly can be fatal. So that needs to be avoided at all cost. So this is just an approach to glycemic targets, as it shows that with the disease duration, the life expectancy, other comorbidities and other complications and resource and support system. If it is very good, you can have a stringent target. If they are not, then the target should be relaxed. So these are the 4 pillars of management, like in any patient: nutrition, physical activity, behavioral modification and medical interventions. Now nutrition is, one has to be, what important thing has to be there in nutrition is that in elderly there is decrease in the bone mass, there is decrease in the muscle mass. So the nutrition, whatever is being targeted, has to be targeted in such a way that has to improve these 2 main things. And sarcopenia has to be avoided or prevented, because generally for every diabetic we say if you are overweight, you lose weight, and that is an important step. But as one loses weight, one tends to lose the lean mass, muscle also, along with fat. So for a 40-year-old, if one loses 10 kgs, out of that, maybe around 3 kgs would be lean mass, whereas a 70-year-old who loses 10 kgs and loses 3 kgs of muscle mass, there's going to be a huge difference in both the condition of both these individuals. For a 40 kg person, it won't matter that much, but for a 70 kg person, 70-year-old or a 70-year-old individual, losing 3 kgs of muscle mass would be very bad, and the person may be more prone to develop sarcopenia or frailty or falls. So that is the major implication. This needs to be prevented. And of course, supplementation with enough protein, because there is degradation of protein with increasing age, amino acids, vitamin D and calcium, because bones start becoming very weak, and this is a very important consideration at that time. Of course, anti-diabetic drugs. Physical activity guidelines are same as every individual, and it depends how much person is able to exercise. About 150 minutes a day, a week, and depends how much vigorous one can do depending upon the existing comorbidities. If there is osteoarthritis, if there is cardiac problem, if there is a liver problem, so all that needs to be tailored particularly. And of course, I would like to add here that muscle strengthening exercises need to be specifically incorporated for the elderly, because that is something you activate the muscles. You activate the muscle, you prevent sarcopenia, and once the muscle is activated, it utilizes glucose for a very long time. So strengthening exercises are very important. Along with that, balance activities. These are particularly important for the elderly individual with diabetes. Now this is pharmacological management. Now in the pharmacological management, the important considerations are: number 1, how many other comorbidities are there? Second, what is the cognitive function status of the patient? How well the patient can follow the advice or take medications on time and take the precautions of taking those medications on time. Number 3 is that socioeconomic status, because many of the medications, good medications, may not be affordable by everybody. And some of these better medications may not be available in the free pharmacies which are there, which are through which generic drugs are being distributed, because the generics are not available as of now. So these three are very important considerations. So preventing hypoglycemia, preventing weight gain, and consideration of cost and access. So these are three main considerations once you are planning to start medications. You want to start the best medication, but if the person is not compliant, you give insulin, the person doesn't take properly, doesn't take meal properly, along with that may end up in hypoglycemia and complications. So that is very important. And one has to know that what is the support system? Who is going to monitor the treatment? Who is going to assist? Because with visual impairment, they may not be able to load the insulin if they are taking, how much has to be taken into the syringe or the pen. They may not be able to see the markings. So all those things have to be seen before any medication or any treatment, pharmacological treatment is prescribed. And as I said, avoiding hypoglycemia, avoiding weight gain, and minimizing the cost of therapy. So if these three considerations are there, different medications are there, and one needs to consider accordingly. I think that was my last slide. Thank you.
Thank you so much, Professor Vikram, for this important presentation highlighting the unique characteristics of the management of diabetes in the elderly. I am now happy to introduce you to Dr. A.B. Day. Dr. A.B. Day is the founder head of the Department of Geriatric Medicine in All India Institute of Medical Sciences, New Delhi, and patron of Association of Gerontology India. Dr. Day was admitted to the Faculty of Medicine of AIIMS in 1985 after completing residency, where he continued till August 2020. He served as the first Dean of Research from 2010 to 2013. A recipient of Commonwealth Medical Fellowship, Dr. A.B. Day spent over 3 decades in establishing old age health and healthcare as a specialty of medicine in India. He was responsible for transforming geriatrics to an exciting and truly impactful field that fosters healthy aging for all. Dr. Day was recognized as one of the 50 healthy aging leaders by UN WHO in the UN Decade of Healthy Aging in September 2022. After superannuation, Dr. A.B. Day is now working as director of Venu Geriatric Institute under the aegis of a not-for-profit organization, Venu Charitable Society, New Delhi, to establish a novel model of care aiming at wellness and healthy aging. Welcome, Dr. Day.
Thank you, Maria. Before I start my presentation, I want to speak something about my previous speaker, Dr. Vikram. It may appear he is only a researcher. No, he is one of the finest physicians in the city of, in the AIIMS, and one of the finest internists in the depleting group of internal medicine specialists in the city. So, please do not be under any illusion that he is just a researcher. He is a very good doctor, and people like us in AIIMS who have retired look up to him as our future source of support and treatment. That's about it. He is also my student. Now, I will take something about healthy aging. My guru, Dr. Vinod Kumar, I was discussing with him about health and healthy aging. So he told, nowadays he prepares for the extempore speeches. I told you, not extempore is not exactly extempore. No, it's not exactly extempore. Okay, I will follow him. So some of the points are there in front of me. I will try to follow that. Is healthy aging an utopian idea? One cannot be aging or aged and healthy as well. It's a kind of a oxymoronic statement that if all your organs are aging, or bodies from cells to organs and organ systems are aging, how can you be healthy? But then it depends on how you define healthy aging. So we define healthy aging in the business of geriatric medicine and the business of WHO even as that despite all your deficits, weaknesses, illnesses, if you are able to pursue what you want to do or what you will always like to do, and you are able to take care of your own self-care, probably you are healthy. It is not possible for a 90-year-old man to run Olympic 100 meters with a 20-year-old man, but if he can walk 100 meters along with his age group, probably he is healthy. If he can think of running, even walking 100 meters along with others is good enough. So we have been trying to understand why people at all decline, why things decline with aging process. So though it's not an utopian idea, so some degree of decline and deficits do crop up, and they are a part of our life process. The most important thing is the biological decline. Every organ, every cell, every tissue is aging, so obviously there will be some deficit. So your cataract, you are unable to hear things clearly, a bit of a pain in the back and the knee, and graying hair and wrinkled skins, and not so handsome look or beautiful look that used to be at the age of 20s and 30s. There is normal biological decline of organ systems. However, as Professor Vikram told, the metabolic process, and he has done a lot of work on the metabolic diseases, that the running fire inside us, which gives us energy to take care of our daily work, is also a cause of our many illnesses. So blood pressure, diabetes, heart disease, stroke, obesity, they are all part of this metabolic process that goes on all the time. It's happening so that we are alive. But most importantly, which has become more important nowadays around us, is the environmental issues. We can look at environment from 2 points of view: internal environment, how our body composition, how our body systems are working. But in a polluted city of Delhi, our external environment has become more important nowadays. Lot of research and lot of articles are coming up every year to say that what other organ systems can be affected apart from your lungs. We did some work in our longitudinal aging study in India, diagnostic assessment of dementia study, LACIDAT, and found that environmental pollution, whether it's a household pollution or external environmental pollution, are causing some damage to our cognition system and maybe leading to dementia. Some days back, I also learned that some group in Rahulkela Engineering College, National Institute of Technology, they are like to look at developing models of diabetes as a cause of dementia and Alzheimer's disease. They are working on that. So probably more and more knowledge comes, and we know that what other conditions inside our body or outside are making our brain go haywire or our body go haywire. And some of these declines are inevitable. So obviously let's accept that if I am wearing a spectacles at the age of 40, which I was not doing at the age of 16, that's a part of my life and probably adds to my personality. So let's consider that some of these things will accompany us and we take them in our stride. So now the question is, what you can do about it? Considering that many of these things are inevitable, which we can't do much about it, let's see what we can do about all these crises or the risks that we have in our old age from the health point of view. Primary prevention and primordial prevention, that is, you prevent a disease from the mother's womb itself, or primary prevention, childhood vaccination, so that's not possible. At the age of 70 or 80 or 90, you can't think of a primarily preventing something, the process of which started many decades back. So we can think of secondary prevention, which means that whatever the defects are, we detect them early, make a right diagnosis and get the right treatment. So secondary prevention is probably more important for all of us sitting in this room, that whenever you feel that some part of your body is giving you a little bit of concern, there is no point thinking that this aging process, if I started new, you have to consult a doctor or a physician or whatever and find out what is really happening with you. So early diagnosis and treatment prevents death as well as prevents disability, which makes a person unhealthy from the activities of daily point of life or the way you want to live that is probably affected. The final is tertiary prevention, that disease has happened, diagnosis is delayed, a defect has started. Now we have to make a person more workable, or he can take care of his handicap, his more functionality is improved, and we call that tertiary prevention. Now we have rehabilitation, then assistive devices. This is an ever enlarging field of medicine where every day some other device is coming up to help you out in your deficits that you have. So what is really the concern at the moment? All those things that Dr. Bikram told will be with us. Diabetes, hypertension, heart disease, etc. will be us. He talked about 3 terms. One is sarcopenia, that muscle mass is going down as we age. Our muscles are getting replaced with fat and fibrous tissue. Our brain is declining, as all parts of the body, number of cells are declining, so brain is also coming down. And when everything is going down, we say that the person has become frail, or frailty of aging, or excessive aging. Some people get into a phase of very excessive aging process and become very weak, bedbound, not able to take care of themselves. So what we can do about all this? There are many ways and means of handling them, but let's understand all the 3 entities do not have any definitive management process that we treat dementia with this drug, or sarcopenia with this, or frailty with this. So basically what we mean to say, proper nutrition, exercise, good lifestyle, probably they can delay all these conditions, and maybe at some point of time they can reverse some of the defects that have set in. So how prepared is our society, our health system in handling a big aging population, as the graph showed by Dr. Bikram showed, that in 25 years from now there will be about 35 crore older people in India, comprising of 20% of the population, because those who have become 60 will become 70, 80, and with good healthcare system, access to healthcare, will go on to touch 100. So the number of people above the age of 70, 80, 90 will become enlarged, because health system will not allow premature death and premature decline. So we'll have large number of people, about 20% of the population of the age of 60 years of age in next 25 years. And is the health system prepared enough? Actually, every country is aware of this. Our country is also aware of this. Last 30 years or 40 years or so, Government of India, all institutions, all state governments have been working on this. When at the beginning of this century, we had no medical college having a department. At this point of time, in 25 years, about 25 medical schools have started doing geriatric medicine. It is not essential that everybody has to be a geriatrician to be an older person. So to consider that it's not possible to have hundreds of geriatricians all over the country, National Medical Commission reviewed the curriculum, and sort of 36 skills are required, essential for every MBBS doctor to have, which has become part of the curriculum now, to handle older people in a proper way and take care of their health problems and prevent diseases and disabilities. So we are in a position of moving forward. The Niti Aayog is now working on developing a strategy encompassing all aspects of aging process, but focusing more on health and welfare and also social support system, so that older people are all good taken care of. So this is work in progress. In coming years, much more things will improve. Let's not forget that there are major technological development with the advent of AI, with ICT and everything. If you think of your younger age, our only source of entertainment was newspaper and radio, which was bulb initially and then become transistor. Now you have got all entertainment in this smartphone. So every knowledge, everything, the Google, the whole source of all knowledge in the world is in my mobile phone. I can look at, find out what is happening. So with the technological development, we feel that there will be major changes in healthcare delivery system, healthcare processes and drugs and everything. So I'm very hopeful that our aging, my aging at least, will be quite safe and secure by the system, by the science, and in the hands of Naval Kishore Bikram. Thank you. Just to end, it's good to be alive and old, because the alternative is dying young, and nobody wants to die, frankly speaking. Thank you.
Thank you so much, Dr. Day, for all the considerations you have presented today regarding healthy aging. To continue understanding the deleterious effects of diabetes, please join me in welcoming Dr. Abhishek Dagar. He is a distinguished ophthalmologist, consultant at Venu Eye Institute, specialist retinal diseases, trained at PGI Chandigarh and at Aravind Eye Hospital, Madurai, Chennai. Welcome, Dr. Dagar. The floor is yours.
Thank you, Dr. Maria. And I thank the organizing committee for inviting me to speak on the effect of diabetes in the eye. I'm an ophthalmologist by profession and essentially an allopath, so I'll be just taking you through the... So essentially diabetes is a group of metabolic diseases which is not just one disease but a continuous metabolic process which affects the eye, the body as a whole. The thing to remember is that even when diabetes is under control, it can still affect the organs of the eye, or the organs of the body, especially the eye. So it's not just the retina, because we were talking about retinopathy, and it can affect, the eyeball is a camera, so it can affect the lens, which shows an earlier onset of cataract. It can affect the optic nerve and the pressures in the eye. It can affect inflammation in the eye, so that will cause uveitis, and like in the rest of the body, there's myopathy and neuropathy. It affects the nerve, the optic nerve gets affected. But most of the visual disturbance is caused by the diabetes affecting the retina. The eyeball again is like a camera, so the back of the eye, the camera has a film, so the back of the eye has the film, the retina, and the retina is fed by a lot of blood vessels. It's the nerve layer which is fed by a lot of blood vessels, and because diabetes affects the blood vessels, there's leakage, and that's how diabetic retinopathy works. So I've just got a photograph of the normal retina, because we all hear about the retina and the eyeball. So this is a photograph of the back of the eye and inside of the eye, and the yellow thing which you see there is the I think instead of the these things are yeah. So instead of, are you doing it? Yeah, okay, I was wondering what is happening here. So this pointer doesn't work? No. So the yellow thing, the sunlight thing is the optic nerve. So try and imagine that this is the back of the eye, and that's the front end of that nerve, and it goes back like a wire. And this is the retina, which is, as you can see, there are a lot of blood vessels there. Next slide, please. Yeah. So essentially, please understand that almost 1/3 of us having diabetes are prone to having some effect in the eye. And out of this, every third diabetic patient, every third would have some vision-threatening disease. And this increases with the duration of diabetes. So even with full control, after 20 years of diabetes, or 2 decades of diabetes, if you had diabetes since say 40, by around 65, you would, there's a likely chance that you would have some kind of effect in the eye. Primarily, it is the retinopathy we talk about, because that's how the vision gets kind of affected most. So you get a lot of blurring of vision, and the treatment options, first and foremost, is we get a good diabetic control, and the rest are auxiliary. There are a lot of treatment options available, and most of the visual impairment because of diabetes can now be treated. And this is more of allopathy. We are sitting in a convention of naturopathy. I think the first line, the good diabetic control, naturopathy and wellness are the prime movers in that. We are like repair people, so we come in towards the end. I think prevention, as Dr. Day was talking about, the prevention or the primary mover should be trying not to get into this, not to come to a repair person in the first place itself. And so this is how bad it starts. So essentially these are very highly magnified photographs of how these blood vessels are like rivulets, you know. So what happens is diabetes affects the lumen or the wall of the blood vessels, the rest of the body also. That's how our kidneys get affected, that's how our muscles get affected. So these blood vessels in the eye are single layer thickness capillaries, and the blood vessels tend to ooze blood. So while a normal retina, when it is dry, kind of dry, it forms images. When the paper is dry, you can write on it, but when it is wet, images, the ink spreads. So that's how the images start getting blurred. And once this leakage starts, the problem is that this leakage tends to worsen. Even if the leakage in blood dries up, it leaves these spots, which then cause a lot of visual impairment. The problem with the retina in the eye is that once it gets affected, there is no way back. You can prevent further loss of vision, but you essentially can't regain vision. And that's what worries most of the patients most. So essentially a good diabetic control, unless we do a good diabetic control, actually you see that the patient had a bad retina in the start, and because it was not controlled well, the leakage after a while, like a tissue paper crumpling up, so the retina crumples up. Like in this picture, you can see that it's got kind of crumpled and sticky, and that's now it's gone beyond salvage. So, and that's when, so as Sir was talking about, the problem with the diabetes or problem with any disease is how it affects the ambulation and the disabilities with which it comes. So if the patient doesn't see well, the rest of the things actually start getting impaired more. With this patient, so essentially blood leaks and you get a lot of blood in the eye, and then the whole thing kind of worsens. But there is treatment. These are again photographs of how the retina kind of gets all crinkled up, and this is retinal detachment. So the optic nerve, as I said, the wire, the front of the wire, you see in that picture, the right side, it really kind of becomes bad, and you can't transmit the images even if they are formed. So treatment options are available, and see in this patient we could kind of laser all the leaking points, and then once the leakage is stopped and the patient gets into a kind of a healthy overlay, the retina stops leaking, then the vision is at least salvaged and not regained, but it is made stable. To a large extent regained, but yes. So again, if the retina is kind of crumpled up, we can actually operate and set the retina back in place and then fix it up with laser. So these are post-op photographs, and I have a couple of videos where you can see that. So this is a patient in which we were operating. We first cleaned up the blood in the eye, and then all the blood was cleaned up, and then we were lasering the leaking points. As you can see, these are the blood has been cleaned up, and all the blood vessels which are leaking, we're closing them with laser, and it kind of salvages whatever vision can be. So it is not that we don't have treatment options. Can you run that other video, please? So cataract, again, cataract is something which, a short video, you can run the first video also. Both of them can run, yeah. So cataract, again, at the institute we have the best machines available, and you can take care of the cataract. On the left side of the video is showing the cataract surgery being shown, and cataract essentially is opacification of the lens in the front of the eye. Again, in a lot of diabetic conferences and diabetic seminars, we tend to speak about the retina, but even cataract is more advanced and earlier onset in diabetic patients. Next slide, the last slide, please. Thank you. So essentially, the key in the managing effects of diabetes in the eye is about a kind of an entire spectrum of treatment should be available, from the cataract to the retina, and management of all these comorbidities or complications of diabetes in the eye. At Venu Eye Institute, we have the entire spectrum of treatment available, and I thank the organizing committee for allowing me to speak on the topic. Thank you so much.
Thank you so much, Dr. Dagar, for your presentation. It is our pleasure today to introduce our next speaker, Dr. Himanshu Sharma. Dr. Sharma is a distinguished naturopath currently working as Associate Professor at the National Institute of Naturopathy. He has previously worked as Principal and HOD at Sant Herdaram Medical College of Naturopathy and Yogic Sciences for Women, Bhopal. He has done his Bachelor in Naturopathy and Yogic Science from Rajiv Gandhi University of Health Sciences, Bangalore in 2005. He did his Master's in Public Health from London Metropolitan University, London in 2011. He has 19 years of experience in the field of yoga and naturopathy, both in clinical and academics. He is a member of the Board of Studies at Madhya Pradesh Medical Science University and is on panel as examiner for various universities. He has been personal trainer for ex-Defense Minister George Fernandez. Welcome, Dr. Sharma. The floor is yours.
Very good evening to all of you. As you know, we are going to speak on the topic healthy aging through naturopathy. So we are all here, and we previous speakers, they have told about naturopathy, not naturopathy, they have told about the healthy aging and diabetes and what's the burden. So usually when I start off, I say that, whole life, we always keep on, we study, as a child we study, and then we start earning, and when we earn money as well as disease at times. And by the time we retire, we always try to get rid of that disease and you want to enjoy. So during that period, while you want to enjoy life, actually we can enjoy life just not by earning money rather than by earning health also. We focus on wealth rather than health. So there we lose actually. And again, it was like, next slide please. So what is aging basically? There are a lot of definitions I found on the web, and aging can be defined as time-related deterioration of physiological functions. But what I say, when a person feels that they're aging, when they feel that they're not able to cope up, or you can say the speed with which they work when they were young, that time they feel that they're aging. So that is like, I can say my definition, when you want to cope up with the life with the same speed and you're not able to do that, then you say that you are aging. Basically, but the biologically, or you can say physiologically, the function says that it is the necessary survival, and it is like associated with different disease coming up, or cell at the cellular level you're losing the functions, or the organ level you're losing the basic functions, physiological functions. So population, and we are, as a medicine is expanding its horizon, we are basically actually in the field where people are growing old, and they live their average lifespan is increasing. But with that, what matters is not the just number of years in growth. Basically, it is the number of quality of life of years in growth. So if you are 70 or 80 plus and you're not able to enjoy what you want to, then I say that it is just you're aging or growing old, but basically you're diseased and you're suffering rather than enjoying your life. So what options we have is like, naturopathy gives that alternative, and it works on it. It's people say that some conventional medicine people say that it is a complementary medicine. We say that it is integrative medicine, and it can be integrated in your lifestyle rather than any other system also. It can be integrated. It's completely a drugless system. So what has been the trend of population of aging in the world? The numbers are increasing every decade. The medicine is advancing. the number of people are surviving more, but you know, the number of, again what I spoke, that people suffering with the disease are also increasing. So globally, the number of persons aged 80 or older are actually increasing from 54 million to 143 million, almost 3 times. So, you know, you might have, what we always say, you know, as a public health specialist, when we say somebody who is, you know, earning and contributing to the country, they are supporting the GDP of a country. But when people, they get retired, they say that you're enjoying the pension, yes. But you know, if you're healthy enough, actually you're also contributing to the country. Because there the government is not going to spend more on the expenses or the setting up the hospitals, or you can say, you know, spending on the medicines or opening up more wards. But if we stay healthy, that you know, expenditure can be spent somewhere else. So I would like to say that, change the slide please. So what's the level is there, like, you know, it's all over world, it is, the trend is same, it is increasing. People are getting old. Europe, again, it is facing, you know, lot of young chaps from India, you know, they have been migrating from country to the other country, European world, and they're offering jobs because they don't have people working over there. They have better living facilities, they provide better infrastructure, better pay jobs, so people are moving over there. The reason is they have certain conditions, certain standards. But yes, even our country, it is enjoying the demographic dividend right now, but over the period of, you know, next 20 years, India will be aging, as Dr. A.B. sir said, that it is going to be 20% of the population will be aging. So, next slide please. So, you know, in India, you know, right now we are at 15 to 64, it is 80%, and hardly 8.1% at 65 plus. But in next 20 years, we are going to be touching 20%, which is going to be double, which is going to have an impact on the younger generation. So how can we reduce that impact? Right now, you know, whole of our lives, we talked about tax regimes and all, as a finance minister presented today. You know, India spends just roughly around 4% of the GDP on health. So, you know, again, asking that from the minister, again, it will be going to, but you know, it's state responsibility, yes, but I feel that it is the first of the individual's responsibility, whether you want to stay healthy or not. If you want to stay healthy, you will take the right steps, right decisions. Okay, next please. What are the causes of aging? So scientifically, what I found was like 2 main reasons. That is oxidative stress, oxidative damage. You know, why a cell gets degenerated, or you can say cell ages. Because whatever we consume, it turns into free radicals, and these free radicals causes oxidative stress. And about 2 to 3% of these oxygen atoms taken up by the mitochondria and reduces it into reactive oxygen species, which becomes highly unstable. And when it becomes unstable, it causes the harm to the integrity of the cell. That is the first thing. That is a natural process again. But how we can stop it, that I'll be dealing it with later, how the naturopathy deals with it. Next one is general wear and tear. We wake up, we do the work, there is damage, and when we take rest and relax, the damages need to be repaired, what nutrition we take in. But when we age, when we grow old, the nutrients are not properly being absorbed, the diet reduces, the appetite reduces, as well as sarcopenia, loss of muscle mass. So somewhere we need not very high quality proteins, not actually even no protein at all. So deficit, where we talk of balanced diet, there we have a special balanced diet for, you know, geriatric patients, or geriatric people I should say, not patients I should say, geriatric people. When a patient word comes, you know, automatically feel sick. So as one gets older, these small traumas need to be, you know, body build, their traumas, these slowly start building up and causes damage to the organ. When the organ dysfunctions, the homeostasis becomes imbalanced. So because of that, there will be mutations, and it can cause to cancer and certain disease like diabetes also. So what are the concerns as the person ages? It is associated earlier death, yes, where the person as fast as they eat, or you can say consumes lot of wrong food habits, wrong lifestyle, it leads to, it is not because of the age, it is because of the long lifestyle, wrong behavior, wrong food habits, that is the reason. It is linked to poor physical health, affecting among others. So Again, it is related to reproductive health. A lot of people like new generation, as you might have seen, IVF clinics coming up. In your times, it was not so. So because somewhere something is wrong, that's why these things have been coming up. Again, what I told about risky health behaviors like eating unhealthy diet, smoking, alcohol, all these again sponsored by a lot of these companies sponsor research, and then they say that wine is good for it, dark chocolate is good, consume it. But again, certain, again, there are kind of biases are there. Then, most important thing, when you work, you engage yourself in some activity. When you retire, you actually, all of a sudden you lose your office and you feel that you are somewhat, you're not contributing something, or you are not busy enough. So all of a sudden there itself the stigma comes, the mental health, and you start forgetting the things, cognitive activities, a slight depression entering. So there you need to get engaged in your own activities. That's the thing where again the aging has been related to. So last one is the lowers the quality of life. You feel that there is not relevance, so you don't, and you may be having suffering from some disease. Then you start thinking that the quality of life has gone down. So basically these are the things which has impacts of aging on a person. Next slide please. So what diseases usually we suffer from? Cardiovascular disease, it's one of the biggest challenges, one of the number one killer for almost, you can say, past 20 years for human population. And usually hypertension, the stress has been contributory factor for it. So because of inactivity and weight gain, sometimes you as a person grow old, they consume too much of food, or they don't consume it at all. So it is not a balanced diet, so which leads to certain diseases like hypertension, dyslipidemia, coronary artery diseases and all. So even the diabetes, there's a tendency of diabetes arises when we have, coronary artery disease with diabetes also, which lead to atherosclerosis and arteriosclerosis also. So cardiovascular disease arises from inactivity and stress. So all of a sudden the person become a bit lazy. Why a person becomes lazy when they grow old? They say that the speed at which the repair has to take place is not occurring. And why it is not occurring? Because of poor dietary habits. We are not giving sufficient relaxation as well as rest. See, usually there is people, they say that it is synonymous, rest and relaxation. No. Rest is for body. We are sitting, we are resting actually. But we are not relaxing. Everybody is listening. So brain is working. So we are not relaxing, but we are resting. And even in resting position, like we are sitting, so you are doing some sort of activity to maintain your posture. When we lie down, when we sleep, we relax. It's a kind of physical rest. It is not a mental rest. So stress contributes to actually it hampers the relaxation, not the rest. People, they keep on lying on the bed and they keep on scrolling the mobile phone. That is not relaxation. That is rest. Okay. So next slide, please. So cognitive health, that's a second aspect which mainly affects the geriatric people, old age people. That is the cognition, loss of, including the cognitive abilities like how to tuck up the buttons, daily activities of daily living, basically brushing their teeth, even this, movement, eating food. Some of the people suffering from Alzheimer's, they have this problem of forgetting the things. So language, thinking, judgment, all those things. So it is characterized by damage to the brain cells. So what is essential for the brain? Actually, the diet should be focused on that, which should be easily digested and easily helping out the brain cells. So, I have mentioned that some of leads to amyloid plaques and neurofibrillary tangles in the brain, which is affecting, basically it leads to brain fogging. So you will not be able to judge what you are doing all of a sudden. It has an impact that really a person starts feeling from inside that they are aging. So it may be perhaps, it is because of aging I am feeling like that. Actually, it is not that. It is because of, indulgence too much in your activity and poor diet is leading to that. And slowly it advances when the time passes. So that's the main thing. So cognitive decline usually begins at the age of 45. So yes, as the sir said, primordial prevention is required. But yes, we can start. The day you start, it is the first step you have taken. You have miles to go. So that's the thing I can say. Next slide, please. So bone and joint health, that is the third aspect where, you know, when you walk around, people say that you need to lose weight, you need to exercise, but there have degenerative joints and the cartilaginous tissue is not coming up properly and it is causing more damage. The synovial sheath erosion is there, and so it will hamper your physical activity all of a sudden. Then the doctor will say, go for non-weight bearing joints, and you don't like it. Sometimes, you know, roaming around and walking in a park or a garden and just doing some cycling. So that is again a different kind of workout. Or swimming is one of the best alternatives, what you can say, but still everybody doesn't like it. In winters in Delhi, you need to have climate control, you know, water temperature control pools then. So loss of bone density, and you know, bone density, we say that minerals and calcium, vitamin D3 and all are very good for bone. But you know, basically bone health is again stimulated by physical activity. Okay, and when we stop it, the bone degeneration starts. And usually, you know, as a conventional medicine people, they keep on saying that take vitamin D supplement, take calcium supplement, it is good for bones, and actually it is not getting absorbed because we are not doing any sort of physical activity. For any absorption to take place, it needs physical activity, some sort of. Yoga can be good, any sort of physical activity is required. And in exercise we say that, you know, it is not always active exercise is very good, but yes, when you can't do, there is passive exercise. So massage is one thing which we have in our naturopathy, so which is good for bone health. Next slide please. What are challenges and opportunities for aging? Aging increases the primary health care and long-term care. That's what I told you. It increases the budget spending on the old age people. So you know what you can do is you can reduce it by, and you can spend. See, whole life what you earn, just imagine you are giving it to the doctor, or you're spending just on, you know, on medicines. And apart from that, even consuming those medicine and going to a doctor, it is fine that it may be a family friend. But you don't feel like going every week or every 15 days to them and saying that I'm again having some issue with it. So you're not actually enjoying it. So I can say that is again a challenge. And you know, it is going to be a bigger challenge for next 2 decades when the number of aging population in almost doubles or even become 2.5 times. That time you need really, see, our culture says that our younger chaps, they are actually generations, they will take care of the old age. But yes, what we are preparing for, they may be preparing for what we have cultured, or you can say sanskaras we have given them, values we have given them. But are we preparing for it? Are we ready to take the challenge? Because the cost of living is increasing, cost of healthcare is increasing. We are expecting everything, nothing free from government. So it is actually a challenge for us. So naturopathy, what it says, like this. So naturopathy is a traditional healthcare profession. We have been following through thousands of years, and it is based on various theories, and it is a drugless therapy. That's why it goes with any system of medication. If you're on medication also, it can work well with it. Or if you're not diseased also, we say that a person has come for positive promotion of health. They have not come for any disease, but to stay healthy also. You know, the virtue is that we always, human being has been trying to, even the modern medicine, you know, it has been trying to get rid of the disease. Rather than the focus should be on how to stay healthy. We are not focusing on how to stay healthy, rather than just somehow this disease should be eradicated. That disease should be eradicated. If we start thinking of how to stay healthy, definitely we'll take the better steps and better decisions. So naturopathy believes in body heals itself. You need to give time to the body. You need to give rest. You need to give relaxation to the body. And you need to give optimal nutrition. So based on the recognition that body possesses not only a natural ability to, because you know you have immunity which fights a disease, inherited, right, when you're born. Certain things you acquire in form of vaccinations, but you have, body has ability to heal itself. So again, Dr. Henley Lindlar, I have not mentioned doctor, he is a person who switched over from, you know, modern conventional medicine to naturopathy, and he says that a system of building entire being in harmony with constructive principles in nature on physical, mental, spiritual and moral planes of being. You need to have 4 levels. In yoga we say that we have panchakoshas, you know, physical body, that is annamaya, what we eat, that we become. manomaya, how we think according negative and positive thoughts. Vijnanamaya, knowledge, the knowledge we gain, every person, the knowledge defines what, again the buddhi comes, viveka, the power of discrimination, which comes from the knowledge, how much knowledgeable we are and how much we implement it. Emotions, sometimes we have, we nurture emotions, we sing, vocational activities we perform. So emotions are nurtured in that way. Sometimes we don't get time at all for those things. So, that is the best part. You don't have to get involved in very frisky activities or body activities for nurturing that. In old age, you can just imagine a person doing gardening, which will give a really good, pleasure, mental. So it helps in improving the cognitive functions also. Prayers, lot of old people, they do prayer. Yes, but yes, it needs prayer needs again the concentration. Next slide, please. So what naturopathy's principle says, what it is based on. First, do no harm. You don't have to give any medication. Don't do any surgeries immediately if it is not required. Okay, then healing power. Leave the things, live the life as much as natural you can. Treat the cause. In naturopathy, we have a theory of holism. We don't say that even the diabetes, it does not come from one thing, just a non-functioning of pancreas. First of all, the blood is having high blood glucose level, or somewhere there is insulin sensitivity. Because of that, the disease is coming. And why the insulin sensitivity is there? Because maybe lack of physical activity in the muscle, or it can be due to autoimmune disorder. Okay, so this again it says that treat the whole cause. So naturopathy works on all the planes of being, that is physical, mental, moral and spiritual planes. Treat the whole person. You don't have to treat specifically each system. If you are treating one system also, it will affect on the whole body. Because it's a drugless system, say if you're trying to treat diabetes for it, so diabetes, again it will be having, my treatment will be based on the muscular activity also, it will be increasing the pancreatic functions also, it will be actually working on the, you can say, bones also. So it is working on all the systems. So as a doctor word, we all say the doctor. So actually it is a term which is derived from the word dossier, which means teaches. So every doctor should be a teacher. Presently I feel sorry because, at times when we consult a doctor hardly gives 5 minutes. And earlier, I think when you were there, when I was child, I should say, a doctor used to tell, this should not be eaten, this not should be eaten for at least 1 week. Don't do this thing, don't have ice things so that it will not affect your tonsils. They were teaching actually the right things. Nowadays, doctor just prescribes and, okay, next please. Like that they will do. So, there, a doctor should be a teacher. So what you can do through healthy aging, through naturopathy, you can basically promote, sun bath. In Delhi, it is at least, sun bath. We always say it, vitamin D. While working in UK, I came to know that, the vitamin D is extracted usually from the sheep's wool. And sheep just grazes all around the green field and they just extract vitamin D from there. But human beings, they lost that. We want fairness creams to be there, but we don't want a vitamin D in our, and which is good for bones. So basically naturopathy has that aspect also, and it says sun bath. It improves, it gives, sun is a source of, vitality. It is responsible for plant food, what plants they grow on the earth. So vitamin D is responsible for it, and it's the sunlight basically. And it is good for our skin, it is good for our bones. It gives a lot of things. So naturopathy helps in that. Next slide please. So naturopathic diet, that is the first prime focus. Any person who is growing old, it needs to have a good naturopathy diet, which is free from preservatives, free from, you can say, pesticides, free from genetically modified diet. And we say that the rich in phytonutrients, like, everybody knows turmeric, curcumin, it has phytochemical curcumin, which is good anti-inflammatory and antibiotic. Resveratrol, very good in berries and you can tomato and other things. Circadian rhythm, we sleep. Usually 18, a child when born sleeps for 18 hours. And what about when we grow old? We should be also sleeping actually, and we say that we don't get sleep. Yes, why we don't get sleep? Because again we take stress. When you retire, You need to rest your brain. You relax and rest. That is more important. Okay. So create healthy sleeping habits, reducing the stress, and yoga helps in that, pranayama helps in that, some meditation techniques will help in that. So it releases massage, again manipulation techniques, massage is one of such things, where it helps in promoting, and the naturopathy diet, certain nutrients, diet having lot of things which helps in promoting tryptophan kind of things which are helpful for the promotion of sleep. Reducing the oxidative stress, naturopathy doesn't promote any preserved, any artificial preservative or chemical to be added to the food. Consume it as simple as that. Well, today we are talking on diabetes. I would like to say that calorie restriction is one such thing, and millets. For past 7 days I've been promoting this millet diet in food. Millets, they're wonderful, they're of Indian origin, they're not genetically modified accordingly, and they are very good, rich in proteins, rich in minerals. It provides calcium, ragi especially. So it helps in reducing all the millets. They're very good. They are reducing the oxidative stress. The fruits and vegetables what we consume. Always we go for packed fruit juices and all. I will suggest go for the fresh ones. We have Venu Wellness in South Delhi, which is one of the best I can say right now, and easily approachable, and it offers all these activities. Next slide please. That's it. I can say that is a one-stop for naturopathy, Venu Wellness. So I can assure you, they will be dealing with all the naturopathy help you can need, and any of them. It is one of its kind in Delhi, South Delhi, and I have come from Pune, but I am native of Faridabad, and I have been practicing for past 20 years. I have worked for almost, 14 years in Delhi, and I just like to say that people have been asking me a lot of times, anybody in South Delhi having naturopathy hospital? We don't have any, but I can say now that yes, Venu is the one which is offering this, and it was an eye hospital again, diversifying into naturopathy, because it is the thing which is helping the people around to change their lifestyle. And at least naturopathy does not cause any harm. It stops when the day you start taking naturopathy, it will reduce the the speed with which the disease is progressing. So that's it. Thank you very much.
Thank you so much, Dr. Sharma, for this very comprehensive presentation on the benefits of naturopathy for healthy aging. To present the concluding remarks, it is now my honor to present to you Ms. Sujata Krishnan, member of the Civil Service's 1980 batch. She is a former Joint Secretary, Ministry of Health and Family Welfare. She was in charge of the National Mental Health Program, National Program for Healthcare of the Elderly, the National Program for the Prevention and Control of Blindness, Deafness, and the National Program for Oral Health and Fluorosis. She brings in more than 3 decades of experience in life social sectors of education, urban development, and health. A graduate in economics from the Madras University, she holds double postgraduate degrees in English literature and public administration, besides a postgraduate diploma in business and industrial management. She is a trained educational planner from the International Institute of Educational Planning, Paris, France. She was on the board of advisors, White Swan Foundation, executive member, Institute of Peace Research and Action, member, governing body, Alzheimer's and Related Diseases Society of India, and advisor to the Staff Selection Commission. She is currently chairperson of the Venu Charitable Society and member of the Guild of Service. Welcome, Ms. Krishnan. The floor is yours for your concluding remarks.
Thank you, Maria, for that, elaborate this kind of thing. But a very good evening to all of you. And I think today we have had an excellent discussion centered on one of the emerging diseases. India has been known as the diabetic capital of the world. We have had some excellent presentations, starting with Professor Naval Kishore, and I think he made it a point specifically, I think keeping in view the audience and everything, to deal with diabetes from especially of the elderly and the points are saying. So naturally, I mean, when we, of course, diabetes is something, it's a lifestyle disease, it's related. We all know that, you know, the diet or what the mother has during a pregnancy predisposes a child to future diseases, and that's also one of those things. There is a genetic disposition also, but like he said, and like Dr. Day also emphasized, you know, our emphasis always has been on treatment after the disease comes in. So I think diabetes, and for the elderly, okay, when we talk about it, there are specific issues that come into play. I mean, with the, of course, life expectancy increasing, the medicines are available, but also when we talk about with this life expectancy also, we need to look at how the risk of mortality is there, how it impacts our health, and for the elderly especially, the degenerative syndrome, the comorbidities also affect. There is complex glucose variability, he spoke about it, the low social support that comes in, that's later. But when we talk about the frailty of health, you know, when we talk about the elderly, it's also about the pharmacology, it's about the frailty, it's about how do you treat. The treatment mechanisms are quite different. And here, I mean, nutrition, physical activity, and the special emphasis that he placed on joint and bone health, how to avoid sarcopenia, how to avoid frailty and falls, and also how to deal with muscle strengthening activities and so on. I think Dr. Day also spoke about the biological decline that happens, how is I think this is something that we cannot avoid. Aging is going to happen. All of us are going to see those little changes in physiology that comes about, and diabetes and other comorbidities may set in. But like he said, early detection and treatment is probably what is possible. If it is already, onset is already there, how do you tailor the requirements to meet those conditions? So if it is, plus also we need to think in today there is advanced technologies, there are advanced things, so how do we live life fully using what medical science has to offer and what is the innovative devices, etc. that we can use. Abhishek Dagar's presentation, especially on the effects of diabetes on the eye, and all of us probably link it to diabetic retinopathy usually, but I think it's like he said, it also affects, you know, has effects leading to cataract. It could affect all other symptoms also. So we need to take care once diabetes sets in, and in this hall with all of us here, as soon as we feel something, we need to have it checked out, and how to do that. I think now comes Dr. Himanshu Sharma. Of course, that's the whole talk of today is this thing. How does naturopathy gain? Like he said, age is a time-related deterioration of physical and fitness. So here we are talking, when we are talking about aging, we are talking about poor physical health, how risky health behaviors, and how mental health decline is there, and all the diseases that can come in. But the emphasis is on bone health and joint health. Aging is demands for also the need for primary health care and tertiary care. But naturopathy as a system, he was particular to emphasize that, you know, we not to see it as a complementary thing, but as an integrative approach. And the naturopathy believes in the fact that the body heals itself. There is your immunity levels can be boosted up this thing, and you do not use other methods or thing. It's supposed to be a drugless care, a drugless treatment. So, but at the same time, one needs to understand that, you know, they are not opposed to medication. So if we are talking about a complementary system or an integrative system, we need to see how this thing. When we are talking about diabetes, of course, allopathics will definitely tell you that you need to take care of your physical activity, your diet, and also your mental and cognitive behaviors. If that is to happen, I think naturopathy naturally comes in. And at the thing is, I think, you know, naturopathic medicine is so important in the management of diabetes, is because it's basically focused on prevention and health organization using lifestyle changes. At the with the Venu Naturopathy Center, we are dedicated to promoting an integrated approach to healthcare that combines the wisdom of traditional practices with modern insight to combat lifestyle diseases. Our aim is to create a platform where experts from diverse fields can share their insights, fostering a collaborative approach to healthcare that benefits society at large. Our aim is to bridge the gap. And incidentally, the current year, 2025's theme for diabetes is bridging the gap and breaking the barriers. So we want to bridge the gap between conventional and traditional medicine. We believe that a balanced, integrative approach can lead to a more effective and personalized healthcare solution. Research increasingly supports combining naturopathic principles with conventional treatments to achieve a more holistic approach to diabetic care. Naturopathy emphasizes patient education empowerment, encouraging patients to take active role in their health, which ultimately improves adherence to long-term outcomes. We believe that combining the strengths of both conventional treatments and naturopathy allows us to achieve better patient outcomes, both in short and the long term. At the Venu Naturopathy Center, we are committed to promoting understanding and collaboration between specialties, and we aim to promote ourselves as a flagship institution for integrative patient care and research in naturopathy. Working alongside specialists, we hope to bring evidence-based naturopathic treatments into the mainstream of diabetes management to improve patient outcomes. We are committed to integrating naturopathy with conventional treatments. And this integration does not replace, but rather complements, I would say, allopathic approaches, allowing for a more balanced, well-rounded, patient-centered form of diabetes care. We are eagerly looking forward to the possibility of working together to make a real difference in diabetes management and care, and for collaboration to improve outcomes. Today's event is one of the dialogues or part of the series of discussions that we hope to bring on board, and it's also part of Venu's effort to break down the barriers and bridge the gap in traditional allopathy, traditional treatments, and also keeping in that this year's theme to bring together the conventional and traditional, allopathy and naturopathy, and to work in tandem so that we can walk the path together for a more patient-centric and healthy life experience. Thank you.
Thank you so much, Ms. Krishnan, for summing up today's presentation so nicely. I am now happy to open the microphone to our distinguished guests for a Q&A session. Please feel free to raise your hand and we will give you the opportunity to ask your question.
Thank you for a very enlightening discussion on naturopathy. I am a physician, Johns Hopkins trained, and I can't agree with you more, sir, that a doctor's emphasis should be on teaching. But you'll be surprised. In Germany they listen. I practiced in Germany. In Switzerland they listen. But in India, when I try, they want a quick treatment and out. They are not interested in taking on board what you're telling them. You know, they want a parchi which gives them a medicine and out. So, you know, sir, it's quite difficult in our country, especially among the, how shall I, the class. I'm not talking of the rural population, they are very attentive. I'm talking about city populations, and especially the so-called, how do you define them, upper and upper middle class. They're not interested at all. What's your suggestion?
Your question?
What's your suggestion?
Yeah, actually, basically it started off. You know, people just want quick fix solutions. That's what I told you about I told you about the level of knowledge. We are training such kind of people. They are just want quick fix for everything. So they're not ready to listen. You know, if you start a discussion, it'll turn into argument that you are not listening to me. So that kind of people we have in our society. So basically, it depends on the person's level. When they have, when the patient comes to us in naturopathy, they actually have been referred from everywhere, all the sorts of, conventional medicine, Ayurveda, everywhere they have taken the medication and they have come to us. This is the last resort. Now, either we have to go to God only after death. So then they will listen usually. So, the wisest of all, depending on their knowledge level, when they suffer a lot, they listen to us. I have been, sometimes, again, it is a tough patient and a simple patient. Some are committed that yes, whatever the doctor prescribes me, it is easy for a doctor. Some patients are quite tough. They will compare. When we work in a hospital where we have 20 doctors sitting, and you don't have to just specifically take. It's like, they can go and refer on some other doctor also. So they will ask, this doctor was telling something else. And in naturopathy, we don't have, for every disease, we don't have a pill. So it's like, allopathy, we have like hypertension, we have certain pills. According to that, we give certain medications, generic medications, I can say. But in naturopathy, each treatment is, designed according to the person. So basically, as a doctor, I can say that, as a responsibility, well, it is up to them if they don't want to take it. But someday, definitely they will take it from somewhere. Either they will go to some spiritual guru or you can say, somewhere they will take it. So as a doctor, I think we should focus on that to make them aware. If they're not, yes, we are doing our duty at the best.
Well, yeah, I would just like to comment on that. I agree with you completely, ma'am, that this is a problem. Now we have, in our country, we have two major ways where a patient gets the medical care. One is the public care system, in which the kind of system that I work in, and the other is the private care system. Now the problems are there in both. In the public care system, like my resident has to be there, and within 4 to 5 hours, he has to see about 100 or 120 patients. So there's no time to educate. That's number one. So we being seniors see a less number of the patients slightly, but once we start telling them, that's the same problem. They want a medication, write the medication, tell me how I have to take it and when should I come back, with what investigations. That is the problem. In contrast to that, in the private care system, it's a totally different. The patient, they are well educated, they are well informed, more informed, so they go with options. Like Google says this, American Medical Association says this, and they go with the options to the doctor. Like, you are telling this, but it says here this has to be done like this. So what is your opinion on that? They will not ask about what is your opinion on my disease. They say that so-and-so says this, what is your take on that? That happens quite often. So there is a resistance to what I would like to educate them in that situation, because they come up with different kinds of references, saying different kind of things. So both of these kind of problems are there, and that is a big challenge in educating the patients.
So when I respond to that, the German system, where I worked in the private sector, they pay the same amount for a unit of service that is paid to a surgeon for minor surgery if you do teaching. So you've got to have records that you are teaching the patient. So I find in private practice, unlike here in India, where I've also done private practice, they are more attuned to listening, because there's been a lot of discussion at various levels. So they come with a much more respectful attitude to learning. So I think it's quite a complex question, and the solution is equally complex.
Yeah, it's been a very fascinating discussion. Thank you so much. Very enlightening, if I may say so. I just have a very, very small question. I think Dr. Dagar perhaps. I wanted to know what was the onset. You talked about cataract and the early onset of cataract due to diabetes. I wanted to know what do you mean by early, onset of cataract? I mean, how early? What sort of age, etc.?
So ma'am, in diabetic patients, we see cataract even as early as a younger age group. And contrary to the popular context, when we talk about diabetes, we talk about retinopathy, but no, that is maybe 20-30% of the patients I see. I see more cataracts. And in a younger age group, as young as say 30-40 when they're insulin dependent. And that is related to either controlled or even the duration of diabetes will cause an early onset of cataract. The question which a lot of people ask is how would they realize that they are getting cataract? So the earliest symptom would be they would get a lot of glare from the lights. And even if they're able to see, possibly, when they're driving in the night or when they look at signboards or lighted boards, they won't be able to see that. So the early onset of cataract starts off depending on when the disease starts. Younger age group, it will start off even at 40. We operate a lot of young people.
Thank you. And what is the normal age for cataract? I mean, I'm just trying to understand. Average.
Cataract is again quotient is what affects you. So the normal age would be nowhere. I mean, if you are seeing well, you're seeing well. I would not want it to be there in any patient.
I had a couple of quick questions regarding what can we as elderly citizens do about 1, 2, 3. So one is sarcopenia. 2 is optic nerve and retina related neuropathy, and the third is peripheral neuropathy.
For sarcopenia, muscle mass is going down, and muscles are primarily made from, they are synthesized from one of the building block is proteins. So you should have enough protein in the diet and exercise to make the weak muscle do more to become stronger enough. So that's what the treatment at this point of time. There are no drugs, no tablets, no capsules to reduce sarcopenia. The treatment is say 0.5 to 0.75 milligram per kg body weight of protein. That comes to out grams per kg body weight of protein. That comes to out 60 to 75 grams in absence of kidney disease. That will be or liver disease. That will be the right kind of a dosage. And with that, aerobic exercise and also some amount of weight bearing exercise to strengthen the muscles. That's how we advise people to take care of the sarcopenia. But prevention is better than treatment. So one must be active throughout your adulthood to keep your muscles working and so that you do not lose muscles. Long-term care, long-term bed boundness, less activity leads to loss of muscles. Your second question was, the eye part will be taken care by Dr. Dagra. I will also comment on peripheral neuropathy. Peripheral neuropathy has got many causes. In diabetes, is one of the important causes of peripheral neuropathy.
So the most important thing about peripheral neuropathy is that first the blood glucose has to be in control. Because if the glucose is not controlled, then neuropathy, there could be a kind of acute neuropathy also which can be there in uncontrolled blood glucose. So controlling blood sugar is the main thing.
Assume it's controlled.
Assuming it's controlled, some of the medications which are given for this, like metformin, given over a long period of time, can cause deficiency of vitamin B12. That can again present as problems like peripheral neuropathy. So controlling blood sugar, if there is a symptom, there is supplementing with vitamin B12, particularly vitamin B complex. That would be one important thing. And one has to take care of one has to take care of the skin. Inform that the skin should be inspected for any problems, any breaches, any breaks. Because along with nerves, the small blood vessels which are there in the end, they also get gradually blocked in diabetics much more than a non-diabetic. So once they get blocked, then that area blood supply gets gradually decreased, and that area is more prone to develop infections or other problems. And there is a neuropathy, there's some kind of infection, some injury happens, the person doesn't come to know, small prick, thorn prick can become a very severe infection leading to a whole diabetic foot. So that needs to be taken care of.
Yeah, as far as the eyes are concerned, as I said, we talk more about retinopathy, but the eye itself gets affected in multiple sections. And diabetic patients, I'm glad physicians now refer for an annual eye checkup, and we tend to pick up any early sign or symptom. As far as retinopathy is concerned, again, as for any other disease or any other part of the body which diabetes can affect, a good diabetic control is very, very important. And as the retina or the diabetic retinopathy you were talking about, early stages it can only be picked up by a doctor, because once the vision starts getting impaired because of retinopathy, it's already there and has been there for some time. And yes, patients are available in a large section of the patients do actually recover good vision and maintain a stable vision if the diabetes is under control. And thank you so much.
Thank you.
Would like to add a few things on that. For nerve health, you need a proper nutrition on the aspect omega-369. Omega-369 fatty acids, they're good in helping the growth of the nerve and maintaining the tissue, the myelin sheath of the nerve, basically. And the next thing is exercise. Exercise gives a lot of conditioning to the brain. And there are certain aspects in naturopathy where we have acupuncture, which gives like stimulation, electrical stimulation. So it helps in the passage, and that's the main thing. So to improve the generalized, you need to focus on omega-369.
Everybody talks about 3 and 6, but people hardly ever talk about 9.
All three are there. It's again basically a ring where it's attached. So it's just like three position, 6 position, and 9. So you can get that over in brain, walnuts and almonds. That's why we are
3 for walnuts.
All walnut and almonds contain that.
Can I just make a comment? I'm public health nutritionist and an academician from Delhi University with more than 50 years of teaching experience and all. So I think what we are talking of, 2 things I would like to address. One about 3, 6 and 9. Definitely omega-3, 6 and 9 are very important. You are also right, because 3 and 6, omega-3 and omega-6 are not synthesized in the body. So they are the essential fatty acids and we have to take it from the dietary sources. 9 is synthesized in the body. Secondly, I think I must say, compliment everybody, the organizers and our panelists and the type of discussion which has been going on. Wonderful. And there is definitely no doubt that if we can have educational and awareness generation sessions, they can play a much more important role in awareness generation, disease prevention and health promotion. So I think in that, probably even my field, nutrition is something I would call it, I always call nutrition is the science of disease prevention, health promotion, curative and rehabilitative medicine. So which Dr. Naval and everybody from All India Institute, I think I compliment All India Institute of Medical Sciences from way back. They have been really laying a lot of stress on the nutrition counseling, and at the same time I would say that if we can have periodic awareness generation sessions, be it in the medical hospital settings, be it anywhere else, and particularly I would like to say that schools and colleges also, which we can approach younger children and the adolescents so that they can form good dietary habits and lifestyle practices right from the beginning. That would be a very good approach. And integrated medicine, that is naturopathy, nutrition, or what you call yoga and physical activity, and of course allopathic medicine is very, very important. So once again I compliment the organization of this session very much. Thank you.
First of all, I will like to pay the compliments to all the speakers. The talk has been very enlightening, I want to seek clarification, particularly on the food habits. Means what should be healthy food habits? Like earlier, the understanding was that there should be 3 meals a day, and in that also the understanding was that perhaps the breakfast should be the heaviest, the lunch should be lighter than that, and the evening meal should be the lightest. So I want to know on that. And the second thing, that for a long time, so much of emphasis has been there all around about the benefits of the intermittent fasting, that taking 2 meals at an interval of 8 hours and 16 hours, like that. So I would like to know on this thing, that what is the proper health habits so far as the timing is concerned, and particularly in the context of a type 2 diabetic. What type of food is it?
See, what you told, 3 meals a day, it is there, and the idea is that people were actually doing more physical work. That time it was to be 3 meals a day. What you told about the breakfast need to be heaviest, yes, because because person was going to start with a physical activity, so they should start with the day, and as the activity reduces by the evening, so the dinner should be the lightest. Okay. So if person is not doing any sort of physical activity or having a sedentary lifestyle, we still don't recommend that person should have 3 meals a day. Rather than they can have a brunch. The concept of brunch came, and early dinner, light dinner. So with that idea and promotion, the recent thing which has been going on for past 3-4 years, that intermittent fasting. Ideally, naturopathy says fasting once in a week without having anything, just juices. That too freshly taken out juices. Okay, so or lemon honey water. So intermittent fasting is a kind of again a fad which started off from brunch or early dinner to intermittent fasting. Okay, and again there are certain more even fads coming up with keto diet and all those things. The reason being, we as a naturopath say that what body needs, every person knows what sort of activity they perform. So if I say 3 meals a day, athletes, we have for athletes 5 meals, but they are small meals, and according to what nutrition they need, what activity they perform, according to that we plan. So each person should consult, what kind of physical activity they are doing. It should be based on that, rather than generalizing for every person. So I will say that intermittent fasting, somewhere it is giving results, but yes, for some people it is giving deleterious effect. It is causing bone loss, even cognitive functions declining, because they are not able to balance exactly. So what kind of activity, what your needs are, that is to be again to be discussed with the. That's why I say integrative. You need to discuss with the family physician.
So I think you can say about Arogya Rakshak Panchatantra as well on intermittent fasting. Could you throw a light on it?
You want? Yeah, please, sir. Okay. Arogya Rakshak Panchatantra, actually what it says, that it is again derived from Swasthya Vritta, and it says that 2 meals a day. Basically, it says that it was like saying in Upanishads, like 3 meals a person becomes a normal, like a rogi, and dvibhuktam, and 1 bhuktam means 1 times a meal is Mahayogi. It is derived basically from there. But according to that thing needs to be interpreted right now in the correct context. So we say that it is like 2 meals is sufficient, which should be balanced, which should be again, sometimes you perform more physical activity, you can have 1 more chapati. You can't say that I will have 2 only. If someday you are not performing activity at all, you can reduce it by 1. So that is the whole idea. What has been a culture is there. What has been written in our ancient text need to be, interpreted in the modern context also. So like, drink 2, it's another aspect is like drink 2 liters of water per day. That is again, if you are staying in Rajasthan somewhere in summers, you can't just have 2 liters, you have to have more. And if you are staying in air conditioner and you drink 2 liters, even you are urinating more. So again, according to temperature and climatic conditions and your physical activity, it changes. So fasting, what it says that you need to give rest to your, fasting means, it says fasting once in a week. So give rest to your body, digestive system specifically, for once in a week at least. So what do you need to consume? You need to consume water or juices, because juices stomach emptying time is quite early. So you need to consume juices. Then you need to pray. That is again for an emotional thing. So Arogya Rakshak Panchtantra, it's emphasized on all these 5 things basically. And you need to detoxify. So that is what it says. Now, detoxification in the form of physical activity, when you sweat, again it is a form of detoxification. If you are urinating more, it is again a detoxification. If you are doing pranayama, again it is a form of detoxification. So that's the whole thing. And correct contest, like you know, right now people have devices like, you know, colon hydrotherapy, where people have constipation, they cleans the lower part of the large intestine also. And then they restore again with probiotics and prebiotics. So it depends on that. That's what you know, naturopathy has also evolved. So it used to be just like enema, now it has become colon hydrotherapy. So machines have, equipments have come up. Sir, please carry on.
So about the nutrition, the two most important things one has to take into consideration before you plan. One, if somebody has diabetes, I'll deal with that first, because in that, the meal timing has to be fixed. The meal timing, because one is on medications, oral medications, or maybe insulin. So in all those conditions, the timing has to be fixed, and it has to be 3 meals if the things are well controlled. But in some individuals, there is so-called a brittle diabetes. That means sometimes it goes high, sometimes it goes very low. So depending upon the situation, the physician who is treating may devise 3 plus 3 meals, 3 major meals and 3 like mid-morning snack, afternoon, and a bedtime snack. So the whole calories, whatever has to be taken in a day, have to be divided into 3 major and 3 minor. So that again, nutrition will depend upon the disease status, what kind of medications are there, only oral or also insulin. So there one cannot play around with any kind of a fat diet. Intermittent fasting, keto diet, and all these are not suitable for patients with diabetes, because they may have adverse effects. If fasting is in patients with diabetes on medications, fasting happens, then the patient will end up with hypoglycemia, and that could be fatal. So there it has to be planned. Now, a situation comes there in certain situations, like suppose in the month of Ramzan, where people fast, but they are not completely fasting. The whole day they are fasting, but they have, before the sunrise and after sunset, they are having a large amount of meal as compared to what they would have on a normal day. So there again, the medication needs to be tweaked. Like in those situations, it needs to be tweaked. But for patient with diabetes, it has to be a structured and a fixed meal timing as much as possible. Now, in a patient who doesn't have diabetes, if you want to prevent, let me come to that, in a normal or a healthy, otherwise healthy person. There, if you want to maintain good nutrition, the balanced diet with a fixed meal timing is good. But if you want to lose weight, then these are the different kind of diets which come into the picture. So intermittent fasting is basically one type of time-restricted feeding or time-restricted fasting. There you can have 16 hours you can fast, and you can take whatever is to be eaten in a window of 8 hours, and the rest 16 hours in a day don't have anything except water. Or some people advocate 14 hours and 10 hours, or 12 and 12 hours. So there are different methods. Not one of them is superior over the other. Like once a week fasting, if you don't have any disease or any other problem, that's also very good. Once a week you give rest to the system. Or intermittent fasting also has a different ways. Like you take 5 days in a week, you take whatever is normal, and any 2 days, whatever are 2 days of your choice, you restrict your calories drastically. Suppose most of the days you are taking 1500 calories. On those 2 days, you take just 500 or 400 calories, and those 2 days should not be consecutive. It's any 2 days of your choice of the week, whenever you are comfortable. Just do that, because that is an intermittent fasting. Alternate days you restrict the calories, that is an intermittent fasting. 16 hours fasting, 8 hours eating, that's also a kind of a time restricted. So all of these are there, and most of them have similar kind of effect on weight, similar kind of effect on metabolic parameters, and it depends which one of these you can follow. What you can follow is you should try and do. But again, this kind of diets are not to be advised or not suitable, in my opinion, for a patient who has diabetes. There it has to be fixed timing and 3 meals or 3 plus 3 meals. That's very important.
Sir, last question.
Diabetes now, once diabetes is detected in the early stages, if you have intensive lifestyle therapy, diabetes itself can be reversed. Reversal of diabetes, lot of data is coming up, is possible in the early stages with intensive lifestyle therapy. Once, having said that, once diabetes is there, once a complication, microvascular complication like retinopathy, neuropathy or kidney problem has started, it generally doesn't go back. It has to be stopped. Once you detect it, treat diabetes aggressively, treat for the particular complication and stop it or delay the progression of that. That's the most important thing. It is not reversible from that.
When you get diabetes at 85, how do you deal with it?
Sir, if you get diabetes at 85, you have to see how much is how bad it is. And as I said, at that age, the targets are not very stringent. As I see, if I see a diabetes in a 40-year-old, then I would like to be very strict, very aggressive, get the HbA1c or sugar to very tight control. Because that person has to live for another 40-45 years. Okay. And if he doesn't, then he'll end up in problem in 15-20 years. But at 85, his diabetes is detected. One can have the control, keep the sugars a little flexible, because at that time, if you develop diabetes, the complications will come 20 to 25 years later. But if you go for a very stringent control, you end up having hypoglycemia, or you could fall, or all those problems. They are much more serious. So one can have a relaxed kind of control.
Would it require medical treatment?
It depends. Again, I said it depends how severe is the glycemic abnormality. How bad is the sugar? If your fasting is 200,
No, it is around 120, 130.
Fasting is up to 125 is normal. Don't have to do anything.
Yeah, just sorry. What you are asking is juice therapy despite the blood sugar level. Basically, what in naturopathy we say that, we usually gulp everything. We don't drink. We gulp it very fast. Juices need to be like, the digestion process starts from when the food enters the mouth. So juice is also a food, basically. So you need to sip it slowly, and it has to mix with saliva, and then the digestion starts. And usually what people think that it is a glass of juice, so I should just drink it and it will quench the thirst. It will not actually get digested. So most of the people actually they don't drink, or you can say right way of eating the juice. I should not say drinking the juice, it should be eaten actually. So all the nutrients need to be absorbed. What happens? The only thing what gets absorbed is the sugars. So what you need to focus on, carrot juice. It is not always the fruit juices we need to consume. We always think that fruits are good, yes, but vegetables are equally good and they are low in glycemic index. So carrot juice, beetroot juice, they are good for actually blood vessels also. So fruits, they are good, tomatoes, they are good for heart, has resveratrol in it. Okay, so certain things, that we have to change the way we take the things. And after just consuming the juice, you feel, because stomach emptying time of juice is just half an hour. So liquids, any liquid you consume, you feel like hungry again. So you need to change the way how we eat. basically. Thank you.
I'll just
Last question, yes. Thank you.
Just last question is, suppose your fasting glucose is within limits, say 90 to 95, and but when your HbA1c is high, so what is the reason for that?
See, relying on HbA1c is a little bit of problem in Indian population, because if there is anemia, if the hemoglobin itself is 9, then HbA1c, relying on the HbA1c can be fallacious. So first thing is that the hemoglobin should be within normal limits. If the hemoglobin is very high, say in polycythemia 16, 17, which you see normally in maybe people with Leh Ladakh, there you can having a 16 or 17 hemoglobin is normal for those people. Or if the hemoglobin is below 10, then the interpretation of HbA1c becomes an issue. So there I think one should rely mainly on the blood glucose levels.
With fasting.
Fasting and post, because the post-meal abnormality is the first to appear.
Yeah.
So a glucose tolerance test would be better screening tool than HbA1c.
Okay. And if somebody's HbA1c is higher, then can we get it screened after a month or 2
Yes,
months?
one has a single point is not always good to make a diagnosis. You repeat it after some time, and better add a glucose tolerance test as well to see whether if actually the glucose tolerance is impaired there.
After how much time?
After about 4 weeks.
To add to Sir's thing, fasting usually, even fasting is around 8 to 10 hours of fast. People, they consume dinner at 12 and early morning first sample will be at 5:30 or 6 o'clock.
That I'm aware, it should be at least 12 hours of fasting.
One more
Thank you so
question.
much. Thank you.
Sir, I have one question. Does stress also leads to diabetes? And also like naturopathy, the emotional wellness and the kind of motivation also helps in in healing the disease and treating the disease as well.
Sure. Stress is a very important factor that leads to development of diabetes, because stress leads to release of so many stress hormones, and many of these hormones inherently have their function is to increase the blood glucose level. They increase the heart rate, they increase the blood pressure, they increase the blood glucose as well in the body. So if that is prolonged, then obviously it is a risk factor for diabetes. And yes, that is why stress alleviating methods like yoga and other meditation and other things, they play a very important role in addition to other things.
The lady around.
So,
Thank you for giving me this opportunity. So I have a number of questions.
So these are just little questions. So one is, we have this continuous glucose monitor. So we have this on our patients and all. So like I have this for my family member and I tried it. And I saw that after eating, the blood glucose reached up to 350 something. So is that a part of the process, or it is something, I mean after 2 hours it settled, but in between it went up to 350. So is that a problem?
Yes, that is a problem.
That is,
in fact, nowadays more and more data is coming up that the 1 hour glucose may be a better indicator for the diabetes.
Okay.
Now conventionally it's a 2 hour which we take, but now 1 hour glucose is, emphasis is coming on to 1 hour glucose values. So in the first hour, if the glucose is going so high, that means this person is likely to have diabetes very soon. Develop diabetes.
This person has diabetes.
If this person has diabetes, then that means it is postprandial hike is very high. That needs to be taken care of by diet or any medications.
Okay. And the second question is to you, sir. How about juices? I mean, there are so many studies and so many dietitians, nutritionists which say that juice are not right. So, I mean, though in naturopathy they do accept juices, except for Karela and Amla. How do you go about these fruit juices and vegetable, even the beetroot and carrot? Are they nice for the diabetics to your patients?
I'm not recommending completely on juice diet for diabetics especially.
No, not completely on a juice diet.
Yes, what you talked about Karela and fenugreek thing. They have some certain phytochemicals like trigonelin and you can say charantoin, which works as anti-diabetic. So we do recommend actually them for the diabetic patients. But yes, diabetics, they are not just prone to the neuropathy. They are prone to, dyslipidemia also, sarcopenia. And, again, for those things, to maintain that, we always recommend juices for those who are not able to chew. See, again, with the holding, the dentures they will be using, they will not be able to chew for a long time. So you need to put the diet in such a way that it has to be consumed. So sometimes, they don't chew properly, because of that they get bloating, belching, all those sort of, problems. So it needs to be prepared in such a way. Second thing, when they are not able to consume anything, sometimes not able to chew, they have a lot of people have teeth problems. So then that time it is the only way out. We have, like in nutrition we say purine diet. You just blend it in the mixer and then you give it so that they can easily swallow it. So basic thing is that juices are the most rich in minerals, but if it is consumed in too much quantity, I'm not saying that it is always good. Anything in excess is always bad. Even if I say that massage take 3 hours a day, it will be bad for you. So it is like that.
I think,
Thank you.
I'd just like to add one clarification. Since it came on fruit juices from 2 people, once we say fruit juices, they are talking of the fresh fruit juice and not the canned ones. Canned are actually sugar sweetened. Secondly, in the fresh also, it should not be a strained juice. What he is talking of is, once you blenderize it, all the dietary fiber and phytochemicals must come. So if your whole carrot or fruit or anything is blenderized and water is added, it will make a juice, but it will have every component of the fruit or the vegetable.
Thank you very much. Ms. Joshi, I will now introduce Ms. Joshi to give the vote of thanks. Ms. Joshi is the Secretary of the Venu Charitable Society and the Managing Director at the Venu Naturopathy Center. Thank you, Ms. Joshi.
Thank you, Maria. I had cataract operated about 1.5 years ago, and my brother-in-law asked me, what used to happen earlier? I said, God made human being that we didn't need any replacements. Thanks to modern medicine and science, longevity of life has come. And with that, of course, a lot more challenges have also come. As we know that, we as an organization have been working in affordable quality eye care for over 45 years. While cataract and refractive errors continue to be the main causes of eye care diseases and visual impairment, like Dr. Abhishek said, that there are a lot of challenges that also have come up in eye care for us. Our mission statement has been good sight and quality life for all. So while we are able to focus on good vision, quality life for our patients, especially now when their longevity of life is there, the challenges are also there. We have, of course, macular degeneration is a challenge, diabetes and lifestyle diseases are a challenge, and that is why we diversify and we now talk about integrative medication or integrated medicine. And what's interesting, as some of you have commented, that we need to have more awareness and more dialogues. What is interesting is that as a country, for India, traditionally and culturally, polypathy is something that we've always believed in. We now need to initiate a dialogue for this integrative medicine, where we are saying that modern medicine and traditional medicine has to go hand in hand. It's interesting that US, which is such a scientific and evidence-based country, is today practicing polypathy. The Mayo College, the Mayo Medical College has a department. And I recently read an article in Times of India. There are over 3.5 lakh practitioners in the US who are talking about integrative medicine. So we are very happy to initiate a dialogue, because before we kind of reject it, we need to learn, we need to absorb, and also critically analyze it. And that's where a lot of centers for naturopathy now are involved in a lot of research, because we are a scientific mind, and we want to know how this affects. Because also, like you said, ma'am, that patients are not willing to listen either, because it's very easy to pop a medicine. But when we talk about naturopathy, it means a lot of discipline. It needs a lot of your own investment. It means a lot of effort in disciplining yourself. As a generation, I can say that, my parents and even for me and my children, we have suddenly seen a lot of abundance when it came to food, and so we became greedy. Now to change those habits needs a lot of discipline. And unfortunately, that is one of the struggles that we have in traditional medicine. But this has to coexist, and this is the way forward. If we really want holistic, healthy aging, as Dr. Day said, aging is going to happen. It depends on us whether we want it to be a healthy aging, so long as we can maintain our mental and physical abilities and functioning. I think that is what is important, and not keep comparing to what we used to be. And definitely naturopathy with integrated modern medicine have to coexist, and we are very happy to initiate this dialogue, and you're most welcome to connect with us, whether through our website or in whichever way. I'd like to thank all our speakers, Professor Naval Vikram, Dr. Day, Dr. Dagar, Dr. Himanshu Sharma, and of course our chair, Sujayaji, and Maria for comparing and holding this event together, and all our staff who have been working behind, and also more importantly to IIC, to the director Mr. K.N. Srivastav, and to I think in IIC everyone knows her as Tete, for giving us this opportunity to be able to interact, and thank you all of you for coming here and making this a success for us. Thank you very much.
Thank you. So fill in your feedback form that is in your bag, and you will find a special discount in your goodie bag. Thank you so much for all your participation, and we hope to see you at our future events. Thank you.